Video series. This video is on estimation of blood glucose meter. Now, glucometer is a point of care testing device which is mainly used for self monitoring of blood glucose by diabetic individuals. Now, what is this POCT? POCT refers to point of care test, which provides analytical information that is used by the patient to make decisions when compared to laboratory tests which are carried out in the central laboratory. So it offers the advantage of carrying out the test at their home. So what's the principle behind glucometer? Now this glucometer is based on electrochemical technology where the enzyme glucose oxidase, which specifically acts on glucose, is immobilized on a strip. Newly available glucometers are based on this electrochemical technology, whereas previously or the older glucometers were based on reflectance photometer. So that difference you should know. Now, so the how actually the test runs. So when the sample which contains glucose is loaded onto the glucometer, the glucose oxidase enzyme, which is immobilized onto the strip, oxidizes glucose to gluconic acid. Now this ferricyanide is also incorporated into the reagent strip. Now this will combine with the gluconic acid to form ferrocyanide, and this formation generates an electric current, and the current generated is directly proportional to the glucose concentration present in the sample. Now what is the procedure of carrying out this glucose estimation in glucometer? Now this is a glucometer, and here are the reagent strips that are present in this bottle, and you need a lancet to prick the finger and a sterile cotton swab. So first thing is you need to insert the reagent strip in the slot provided in the glucometer. Once the strip is in the right place, a sound emerges indicating for you to place the sample. Now, so you are supposed to clean the area of the finger where the prick has to be done. So now using lancet, prick the finger, and once the blood starts, you are not supposed to squeeze the blood, so blood should come out as a drop. Now place this drop of the blood on the reaction area on the strip. Now this is how you get to see the smooth flow of that drop of blood into the reaction area on the reagent strip. So once this is done, so the glucometer displays the blood glucose values. Now you have to meticulously practice this in your practical sessions in your respective institutions, because this glucose estimation by glucometer is usually kept for OSPE examination, objective structured practical examination. Now, so glucose can be estimated by different methods. One is by glucometer, other one is in the laboratory, central laboratory of the hospital, which uses the venous plasma or the venous whole blood glucose. Now, there are a couple of difference between glucose estimation by these three methods, and you need to know this difference, and this will help you towards better practice, towards better patient practice. Now what are these differences? Now the sample that is used in glucometer is the capillary blood sample, which is obtained by finger prick. In venous plasma glucose, which is the gold standard method employed in all central laboratories, here the venous blood is collected from median cuboidal vein in a gray color coded vacuum which contains fluoride and sodium citrate and anticoagulant. Now fluoride, which will inhibit the enolase enzyme of glycolytic pathway, so you will not get false low values. Now that's the rationale why you need to use fluoride bulbs. Now for venous whole blood glucose, again the blood is drawn from median cuboidal vein but in red color coded vacuum. Now it is allowed to stand for some time until the blood clots, then the sample is centrifuged, and when it is centrifuged you get to see serum. Now this serum is used for estimation of the glucose. Now in venous plasma, what has happened, you had used fluoride bulb where the blood was drawn from the median cuboidal vein and in a container, gray color coded container that contained sodium citrate and fluoride, and this can be immediately centrifuged, and the supernatant you get is known as plasma. So this is a difference between the venous plasma and the venous whole blood glucose. Now what is measured in all the three different methodologies? Whole blood glucose is measured in glucometer, whereas plasma glucose is measured in venous plasma, that is laboratory standard, gold standard. And again whole blood glucose is measured in venous whole blood one. So what is the method of estimation? So electrochemical technology is used in glucometer, whereas enzymatic methods are used in venous plasma and venous whole blood glucose. The most common enzymatic methods include the hexokinase or the glucose oxidase peroxidase method. And what's the use of these three different methods? So glucometer is mainly used for self monitoring of blood glucose by diabetic individuals, or it can also be used as a bedside instrument in hospitals also. For diagnosis and confirmation, venous plasma is the gold standard and venous whole blood is not actually preferred. Now what is the accuracy of these three methods? Now capillary whole blood or the glucose estimated by glucometer, so you get to see 10 to 15% higher values when compared to venous plasma glucose, because this measures the arterial blood glucose. So when difference between the venous plasma and the venous whole blood, again 15%, 10 to 15% higher values are noted when you estimate the glucose by using plasma when compared to serum. This is because plasma contains more water. Now, what is the difference between the fasting and the postprandial values among these three methods? So, in the laboratory gold standard, that is venous plasma, the fasting blood glucose values is around 70 to 110 milligram per deciliter in healthy individuals, and this is similar values you get to see in glucometer, whereas the values are slightly lower in serum or the whole blood glucose, because the plasma contains more water and the values are more here. Now coming to postprandial glucose, in healthy individuals it is less than 140 milligram per deciliter when estimated using venous plasma method, and in glucometer it is usually more than the venous plasma glucose because it reflects the arterial blood, and serum slightly lower, and actually it is not preferred one. Coming to the diabetic cutoffs, the fasting should be more than 120, more than or equal to 126 milligram per deciliter by the laboratory gold standard with venous plasma. So serum sample is not preferred, and using glucometer, if the sample is more than 126 milligram per deciliter, the diagnosis has to be confirmed by venous plasma glucose. Coming to postprandial cutoff for diabetic individuals, it is equal to or more than 200 milligram per deciliter with respect to venous plasma method, and serum or the venous whole blood is not preferred. And if using glucometer the values are more than or equal to 200 milligram per deciliter, the diagnosis has to be confirmed again using venous plasma glucose in the standard central lab. Now, hematocrit does not affect the venous plasma glucose. However, it affects the whole blood and the glucometer values. Now, hematocrit is nothing but the increased erythrocytes. Now, when with high hematocrit, what happens to this glucometer glucose reading is you will get to see false low values. So this is one disadvantage when you are using glucometer and when the person is affected by high hematocrit values. Turnaround time is immediate with respect to glucometer, and it is around 1 to 2 hours with respect to venous plasma. It is slightly delayed when the serum sample is used, because after collection of sample we need to allow the blood to clot, and this will be followed by centrifugation. So with venous plasma, what happens is you can collect the blood sample in the after adding the anticoagulant fluoride and sodium citrate, and immediately you can centrifuge and you can do the estimation. So that's the difference between the turnaround time of the three methods. Coming to diagnostic use, glucometer is mainly used for self monitoring of blood glucose by diabetic individuals, whereas the venous plasma is the gold standard or the diagnostic standard, and serum or the whole blood is not preferred. Now, so when a patient is using this glucometer, so newer glucometers, there is facility for provision of plasma equivalent glucose, which is similar to ADA criteria, that is American Diabetic Association criteria. Now, for the patients who are using older glucometer, now this plasma equivalent glucose will not be provided. So what they need to do is they whatever the glucose values they get, it has to be multiplied by a factor of 1.11 to get the plasma equivalent glucose values. Now the venous plasma, whatever the values are very much approved by this AD or the WHO, American Diabetic Association, and the WHO criteria. They are based on venous plasma values. And however, these venous whole blood values are not preferred by AD and WHO. So these are the differences between the blood glucose estimation by glucometer and using venous plasma, that is gold standard, and venous whole blood. So this was all about this glucose estimation of blood glucose using glucometer and the differences. Thank you so much. Please do like, share and subscribe this video. Next video will be on estimation of blood glucose by glucose oxidase peroxidase method, most common method that will be used in the central lab, and this is the elaborated standard or the gold standard method. Thank you.